Hi, I'm Kevin Brigle. I'm a nurse practitioner and I practice at the Massey Comprehensive Cancer Center at the Virginia Commonwealth University down the road in Richmond, Virginia. And I'm here at JADPRO 2025 at the National Harbor in Maryland. Demonstrating proper position is important. So whether it be the Ommaya access, where the patient is sitting up and gently facing you, or the lumbar puncture, where the patient is actually not facing you and kind of bent over a table, but getting them in the proper position to make the procedure easier for them and for you. And I think one thing we stress with the patients in the lumbar puncture is the curvature of the spine and getting them into the exact proper position and having them stabilized is really important to make this procedure easy, especially with the lumbar puncture. Again, the site where you're accessing is very small, and so increasing the ability to access that site is really important. And again, I think as much as anything, the less time you're back there, the quicker you're successful, that patients have much more comfort level to it as well. And so once we've done that, we teach them the proper procedure from opening the kit and going through and actually preparing the patient's back and then actually doing the procedure itself, which includes adding the lidocaine and then how to exactly put in the needle and where to put in the needle and advance the needle to get the cerebral spinal fluid. And then once you get the fluid, then attaching the chemotherapy agent and pushing that back into the spinal canal. And then again, once that's finished, you have to wrap up and then properly cleaning the patient, positioning the patient afterwards. It's very similar then with the Ommaya access. That's a little bit easier, not quite so technical. So showing patients how to find the Ommaya is really important. Priming the Ommaya and then accessing the Ommaya, the proper procedure for drawing out the samples again, and then pushing back in the chemotherapy and flushing that chemotherapy out of the Ommaya. So a complicated set of instructions for both of those, but that's the importance of the workshop, is to understand that repetition, do the same thing every time, and it becomes a lot easier when you actually come to a real patient. And then I think the really added value of attending one of these workshops is then again these models really approximate what it's like going to be on a patient. When you start working with the patient, and this repetition is that hopefully it increases your ability to become proficient, because that's really what you want to be, is proficient, and much sooner than if you were just approaching this cold.